Ooh, that light is bright. So we thought about it and we decided that it was better to go ahead and treat Leaflet's nose tonight. I'm not really sure what it is that's going on that's getting so many of their noses injured. I don't know if it's just normal fighting, dominance fighting, or if they're, I have no idea if I'm even on camera, or if maybe they're getting into briars and getting a little tiny hole in their nose and it's getting infected. I'm not sure, but this is the third or fourth one that we've had with a schnoz. So let's see how she does. It's over on one side this time. Poor baby. I'm sorry. It hurts, doesn't it? So let's see how it works out. I'll record it if we can. The rain and the mud make this very treacherous. But I would rather slip a little here than have to walk through the giant puddle that is the road. We made it. All right. Poor little Leaflet. I'll get your nose in there so they can see it. It's so hard to tell with the way that your nose is pointed, but I can tell. Yeah, I could tell when I saw you running by. We have to be careful what medicines we give her, since she's hopefully pregnant. It's hard to tell, but she is due this week. If she is pregnant, you can kind of tell how it's swollen, making her nose look kind of funny. She's not a great marked rabbit, but
He says she's pregnant.
I don't know how he does this. I know there are all kinds of videos on how to tell. I've never been able to tell. It all feels like babies to me.
I don't think she's pregnant.
I think she is. I'm not surprised, but could she have one hiding from you?
She could. I don't feel any pregnancies at all.
Poor Leaflet didn't get pregnant.
I'm not expecting anybody out there to have these particular drugs on hand. I'm a licensed practicing veterinarian, so it does come with a few privileges. I like to put some lidocaine down in the wound, just like Dr. Pimple Popper does,
And I like it when you do too.
and give it just a minute to take effect. So, lidocaine is a prescription controlled substance. So, yeah, it's not a controlled and like it's a class 2 drug or anything like that, but it's prescription only. You have to have a prescription to use it. I'm going to give her some oral, 10 milligrams of oral Baytril. Now, Baytril isn't approved off-label use in rabbits for various conditions, but you do have to be mindful that you can't eat this rabbit. And it's 28 days in cattle and sheep before you can meat them or eat them. So I always say in rabbits, if we use Baytril, if they're in the food chain at all, at least 60 days. And you have to remember that since there's no federal guidelines on that, if you treat a mama rabbit with Baytril, it would be best if it was like 6 months, before you put her in any kind of food chain whatsoever, to make sure that there's absolutely no residuals in that meat whatsoever.
And you definitely don't want to sell her to somebody without telling them.
Yeah. So don't use antibiotics unless you absolutely have to. And then if you do use antibiotics, be responsible with those antibiotics. It's very important to not induce resistance. It's very important to use them properly. But it's very important that we don't contaminate or make humans sick, okay? So we record her treatment and the day that she got treatment and everything in there. If a year from now she doesn't have any more antibiotics and we cull her from the herd, I don't care a bit to sell her for meat or even to eat her myself. I don't have a bit of problem with that. But I really think you need to minimum 90 days on a meat rabbit, okay? Probably you could get away with 60 days, but I would just
Err on the side of caution.
I would err. Yeah, I would not do it unless you just have to. Okay, so I gave her lidocaine in the wound, and I gave her some Baytril for the infection, and now I'm going to give her some pain medication. And again, non-steroidal, anti-inflammatory, will not cause abortions. It's called ketoprofen, but it's very powerful. Who knows how long it lasts in a cat, and I'm sorry, in a rabbit, but you usually get a day and a half of a really good effect in cats. In rabbits, I don't know, it's varying. I've seen it, really help them with their pain almost instantly, in 20 minutes, and then over a period of time, they just improve dramatically. Okay, so I'm going to find my alcohol. I want to rub a little alcohol. There we go. Just a little bit on there. It's not over there.
That looks like an alcohol bottle, but it's not.
Well, we may have used all the alcohol.
It's entirely possible. We just got the
Well, I was washing feet with it.
washing feet, doing a good old foot washing, alcohol. There might be baby wipes
Okay,
in the car.
we'll switch and use a little bit of betadine then, because I want to get chlorhexidine. Excuse me. I want to get chlorhexidine close to that wound there. So we'll just put a little betadine on it.
He's gonna make my gloves be a funny color. And he's gonna make you be a funny color.
We have storms that are getting ready to come through Saturday, and you can tell the weather is changing.
What is that?
It has warmed up a lot.
We have a bird in the attic.
Oh gosh, yeah, several of them.
That must be what's making that noise.
Well, it's the metal popping from the wind blowing too.
Oh, that could be.
Holy crowley.
Ew.
Yeah. It's pretty nasty. I'm going to open that up a little bit more now. So, I'm not going to make a huge wound. I'm going to use an 18 gauge needle. These are cutting needles, so they actually have like a scalpel end on it. And I'm just going to make the opening a little bit bigger.
And I'm not gonna watch. I don't like it. It makes me sad. It makes me hurt.
Well, I put a lot of
Oh
cane in
my
it.
goodness. Look at that nasty goo. Bunny, you got nasty goo. Why is it always white? It's just so gross. Poor baby.
Oh, what a pimple.
Gross. Don't sing pimple songs. Oh, I didn't like that. Oh, did you have a scab? I don't know. Your trash can's all the way over there. Look at my poo poo poo. Oh, it's starting to bleed a little bit. Poor sugar. It's gonna feel better though. It'll stop making you wink your eye.
Let me get some water here.
That's not. Okay.
It's close enough. It's old. Electrolytes are okay for this.
I just thought you might think it was.
Okay, now I don't want to mess with it too much. Number one, it's painful. Number two, we just want it to drain. And it's coming out of there really nice. Alright, I do not think this is an abscess tooth. I just think it's a run-of-the-mill. They've been fighting and somebody stuck a fingernail in her, or she got stuck by a piece of hay that set up an abscess or something like that. But it will drain good now, and it'll be fine.
Poor baby. I'm so sorry.
I do think it's important to follow up with antibiotics, a minimum of 3 days. You know, I'm using a little bit higher dose, so she's going to have an antibiotic effect after that 3 days for an additional 2 or 3 days, just because of their metabolism and stuff. I think it's fine to do that. But, you know, there would be nothing wrong with treating her for, you know, a week if you wanted to, for the abscess. But we'll keep it clean and watch it. And everyone I've treated so far, even the really bad, we had one on a rabbit eating half its face off.
The schnoz.
Just came out one day and its whole head was swelled up, and we treated it, and it just granulated back. She did fine. I think in a colony situation, I wasn't expecting to see as many like little abscesses like that as we've seen. That was kind of a
But you could be right.
new
They
thing.
do like to paw at each other. You could
Yeah.
That could very well be a toenail situation making these little schnoz problems. Poor baby. I'm so sorry.
Now, when she says making these schnoz problems, I'm talking like of 100 rabbits, we're talking like 3,
I think this is the 4th one.
maybe 4. Yeah, so it hasn't been a huge problem. It's
But
just been a
It's
new
probably
problem.
it's probably the 3rd one since we did the colony.
True.
Andy Davis got hers in the cage before we moved her to the colony.
That's true. Okay.
Alrighty, say goodnight, Leaflet. Say ow ow, it'll feel better later. Actually, you probably don't feel anything at all right now with that lidocaine. Say yay, lidocaine.